Ayurveda health system, traditional Indian medicine, develops and ongoing research. Ayurveda means science or knowledge of life, and is the name of a traditional form of medicine developed in India between 3,000 and 5,000 years ago. Some of the oldest surviving literature discusses Ayurveda. Two medical books over 2,000 years old are the main texts exploring the branches of Ayurvedic medicine, including internal medicine, surgery, treatment of head and neck diseases, gynecology, obstetrics, pediatrics, toxicology, psychiatry, care of the elderly, rejuvenation, and sexual vitality. Ayurveda is believed to have formed the basis for Chinese medicine. It has widespread prevalence. It is practiced by about 80% of the Indian population. Most major Indian cities have an associated college and hospital. It is also practiced by a large part of the populations of Bangladesh, Sri Lanka, Nepal, and Pakistan. Its prevalence in the U.S. is said to be increasing. In 2007, there were over 200,000 people here practicing Ayurveda. The main U.S. centers are in Massachusetts and California. The beliefs of this system are centered around balance. The body is said to be made of basic energy elements and a specific personal balance. Ayurvedic principles foster balance in the body and mind of three main types of life energies in order to achieve the balance natural to that individual's constitution. The three main dosha or body types are Vata, Pitta, and Kapha. Each is dominated by two of the elements of fire, water, earth, air, and ether, or space. Vata is dominated by ether and air. People with this dosha tend to be thin, anxious, susceptible to skin, neurological, and mental disorders. Pitta is dominated by fire and water. They tend to be of medium build, perfectionistic, and susceptible to ulcers, heartburn, hemorrhoids, heart disease, and arthritis. Kapha is dominated by earth and water. They tend to be of larger build, procrastinators, and susceptible to obesity, diabetes, allergies, sinus problems, and asthma. The treatment: initially, a practitioner will determine the dominant dosha. They center the treatment around eliminating impurities from the diet. They focus on reducing symptoms with meditation, like yoga and exercises, increasing resistance and immunity using herbals and tonics, and reducing anxiety and fostering harmony through avoidance of difficult times and communication. The Indian government began funding research on Ayurvedic medicine in 1969, which continues today. In the U.S., the Benson Henry Institute for Mind and Body Medicine notes that within the past 5 years there have been Ayurvedic studies published addressing the effects of complementary practices on clinical outcomes of patients undergoing treatment with radiation therapy for prostate cancer, improving anxiety, depression, and pain relief, and improving the chances of patients to tolerate reduction in antihypertensive medications. The research example on the last page, the final one, in the article outlining it, it was decreasing the number of antihypertensive medications needed, and explains a double-blind randomized trial that compared 8 weeks of relaxation response training in 61 patients with traditional lifestyle modifications coaching in another 61 patients. At the end of that study, those patients who had achieved a systolic blood pressure of less than 140 were eligible for 8 additional weeks of training with supervised medication elimination of 1 antihypertensive. 44 in the relaxation response group and 36 in the control group qualified. The final results showed that the relaxation group was more likely to successfully eliminate an antihypertensive medication. The article concludes that the relaxation response training has the potential of decreasing risks of stroke by greater than 30% without additional medications. This side effect-free treatment strategy can benefit patients by preventing vascular events as well as decreasing the cost of drug dependence. The Indian culture holds value in the use of herbal preparations. The Ayurvedic herbal formulary contains over 600 herbal formulas and 250 specific plant remedies grouped into categories according to their effect. Western medicine has concerns regarding certain Ayurvedic preparations because of the potential toxicity, interactions, and the lack of formulary uniformity and regulation. Asking about complementary and alternative medications with a supportive plan to attempt integration is the safest and most effective strategy for developing a treatment plan.